Thank you, Annette. Lots of information there. Our next speaker is Eileen Myers. Her title is Insights from the Retail Sector, the Little Clinic at Kroger. Eileen is Vice President for Affiliations and Patient-Centered Strategies for Little Clinics at Kroger. Let me just say, too, please write down your questions so you don't forget them. We are having a panel, and you'll have a chance to ask them.
Well, thank you. So this morning I was very pleased to be invited. I did say when Maria invited me, and thank you, Annette, for suggesting me that the Little Clinic, which is a retail health clinic, is evolving. We're not specifically working with the dietary needs of the older population, but it's exciting to know what we will be doing, and I'm excited to talk to you about the Little Clinic. Before I talk about the Little Clinic, though, I have to talk to you about Kroger, our parent company. Kroger is an amazing company. It was founded in 1883 by Barney, and it's headquartered in Cincinnati, and right now we have over 2,600 stores. We operate 24 brand banners, so you may not know Kroger, but you may know Dillon's, or you may know Ralph's, or you may know Fred Meyer. You may know King Soopers, which was a slide Annette put up. So lots of banners, and Kroger is very invested in its community. So its core belief in building strong community ties. So when Annette talked about 2 visits a week to the grocery store, Kroger has 8 million customers a day who walk in our grocery stores. So why do I tell you this? Because what I want to do in my presentation is have you think about opportunities for helping the dietary needs of the elderly and the older population in a retail setting, and then also in the retail health clinics that are coming to be. I love to talk about Kroger and its generosity. So in 2012, Kroger was quoted by Motley Fool as not only focusing on growing its brand and bottom line, but realizing that the community building is the way to go, and was recognized in 2012 as the most generous company in America. So Kroger is a founding partner of Feeding America. So I think, again, in terms of some of the topics yesterday, really important to see that back to generosity of Kroger. For over 30 years, Kroger has assisted Feeding America and its mission through a nationwide network of local food banks and by engaging communities. So what does Kroger do? Kroger absolutely donates food, it donates dollars, and it donates time. And again, what I love about Kroger is it's not about just donating, but it's engaging our own associates to make us part of the community and help us recognize that it's important that we all are out there helping our communities. So one of our speakers a few weeks ago at a national meeting with Kroger talked about the fact that now food that we will not sell will go to the food banks. And unfortunately, years ago, it went to the landfills, but now it's hundreds of pounds of produce are rescued and given to food banks. And over the last 5 years, we have donated 1 billion meals through our generosity. Also important in terms of Kroger is its value of diversity and inclusion. So Kroger's committed to ensuring that everyone who walks in our stores feels welcome, valued, and respected. And when you think about the 2,600 stores across the country, you will find our Kroger stores in every types of neighborhoods. In terms of understanding our customers, Kroger owns a company called 8451, and I'm not sure if you've ever heard of 8451 because it's a brand new name, but some of you may be familiar with the name dunnhumby. And dunnhumby Kroger was part owner of dunnhumby, and then purchased most of dunnhumby and changed its name now to 8451, but that is our consumer insights company. And what is just fascinating about what we can do for our customers is that instead of looking at segmentation with customers, instead of looking at what is the demographics of this community, or what is the age, who do we service, dunnhumby and of course through our Kroger Plus card, we get to know every single household. And so what does that mean? So it means that if we know every single household, then what we want to know is, what do you need and how can we help serve your needs? So Kroger is committed to improving the health and wellness of the communities it serves. So one of our initiatives just recently was that we joined the American Diabetes Association as a national strategic partner. So again, we do donations and we promote physical activity, we promote diabetes education. And again, our associates get involved. Our associates are on the walks and feel a part of this commitment to the American Diabetes Association. Kroger has 1,965 pharmacies throughout 32 states. And as Annette was talking about the pharmacists, and pharmacists are busy, they're filling a lot of prescriptions. But again, there is a commitment by Kroger that the pharmacists will also be clinical counselors, that they will help our patients in terms of medication therapy management. They will help our patients in terms of looking at what they're taking and any interactions. Our pharmacists have done a lot with coaching and being trained in motivational interviewing and in coaching our patients. And more now they are going out working with our hospitals and our health systems to be available for that transitions of care. So far I talked about Kroger and Kroger Pharmacy, and now I'm going to switch to the business unit that I work for, and that is the Little Clinic. So the Little Clinic, we are the health clinics, the little health clinics inside of the grocery store. Currently, we have 181 clinics, and we're in 9 states. We're Joint Commission accredited, so just like hospitals and just like ambulatory care centers, we felt that it was very important that we got Joint Commission accredited so that our colleagues in traditional healthcare would recognize us for quality. We've actually been through 3 Joint Commission surveys, so we've been reaccredited 3 times. This is a picture of just what our clinics look like so that you could have a sense of the feel of the clinic, that we're attractive, we are built into the stores, we have nice waiting rooms, we have nice exam rooms. It wasn't always this way. We were once a kiosk that was just kind of in the middle of the store, and it was noisy, and the patients sat right outside in front. But we really have come a long way, and we've done that, again, for the patients that we serve. These are the types of services that we currently provide. So what you see is what we do mostly is acute episodic care. We do immunizations. Again, Annette brought up immunizations, and that is where we do see more of the older population. The majority of our population currently is more what we have always identified as the soccer mom who comes in and is busy and has the kids, but more and more we are seeing the older population. So we are open 7 days a week. We are open from 8:30, depending on our region, to about 8 p.m. So we have the evening hours, we have the morning hours, and we have the weekend hours. So we're readily available, no appointment necessary to be there when people need us. one of the initiatives that we felt was very important is our health system affiliation. So that is my job, and what does that mean? So again, as we look at every Kroger and every division, what are the needs of that community and how can we help? So we affiliate with health systems, and the ones listed are some of our affiliations. So we meet with these health systems and we look at gaps of care, we look at what are their struggles, how can we be helpful. So some of the things that we do is, again, if somebody needs to get in, I'm sick right now, then I can't get into my doctor's office, but they say, why don't you go to the little clinic? In about half of our affiliations right now, we have an interface with our electronic medical record so that the record is shared with the primary care physician. So we see that patient after hours, we see that patient the same day. Working with one affiliation right now in terms of looking at the post-discharge and how we can be helpful, getting that person seen so that there is not a readmission. And then we are a portal for chronic care management. So what does that mean? So, and this is where the older population is more of our the customers that we're serving. What we will do is two ways. If the physician's office is seeing a patient and that patient is non-compliant or they can't get in because of their work schedule, then they can be seen at the little clinic for that next care visit. Also, and probably more of what we see, are people who just won't go in for care. They have high blood pressure, they have diabetes, but I don't have time. My job, my schedule does not allow me to, and I don't have potentially the resources, the finances. So working with a protocol that's approved by our health system, we see those patients. And I didn't even say that our clinics are operated by nurse practitioners and physician assistants. So we are qualified, and it's within the nurse practitioner scope of practice to be seeing those patients. And so we are helping those patients be seen, and then they're also being seen in between visits because we do free screenings, and they're seen in between visits because they're grocery shopping and they stop by to say hello to us. So lots of opportunities for engagement. This is a brochure of our affiliation with the University of Cincinnati and our diabetes management. But what I'm most proud of is the fact that we are seeing people who just are not treated at all because they can't get in, or they can't get in because they can't get into their doctor, or they can't get in because of like I said, the time. So what are the strengths of our retail clinics? Again, they're convenient, they're cost-effective, high quality. We could identify, diagnose, and treat. We have blood pressure screenings going on. Again, any customer can stop by our clinics and get a blood pressure screening. We have lots of opportunities for blood glucose screenings. We are connected to the health systems. We want to participate in population health management programs in terms of being that stop for people to get care. As I mentioned, we are an opportunity for additional touch points with people visiting our stores so often. I added the next bullet, clinical trials, because I want you to all think about if you're involved in research. So in our clinics, we can be a portal for your clinical trials in terms of patients who need to be seen frequently and need an assessment, maybe again a blood glucose screening, a BMI, et cetera. We can do that, and we have done that. And then in terms of our clinics, as part of the whole store, we are working towards more and more integration with pharmacy and the store and our clinics with health and wellness opportunities. I have here in terms of nutrition, one of our new initiatives is that we will be hiring more dietitians. We have dietitians, but we are going to have many more dietitians because Kroger is committed to helping our populations, and we know that dietitians are important. Barriers to doing more, we would love to do more, and unfortunately there's some legal and regulatory issues that don't allow us to do more. In some states, our clinics are more restricted in terms of what we can do. In some states, they don't even want us there, and what's really hard for us to kind of hear, and we scratch our head, is those are typically the poorer states that struggle with the retail health clinics. Payers, we sometimes struggle that they will pay for traditional physician visits, but they will not pay for the little clinic visits or retail health visits. And then we do have some barriers around just the traditional medical culture. Sometimes, and probably more frequently, there's pediatricians that will struggle with the fact that we're seeing kids, and should we be seeing kids, and more and more we're breaking down those barriers, but traditional healthcare sometimes has a problem with this new way of healthcare. So in terms of who we see most frequently and who's our core audience, it really is, and what we're working to achieve is the low risk and rising risk population. That is the opportunity for the little clinic, and that is the opportunity for Kroger. So in summary, you know, what we want to do and what we can do, especially through our 8451, our customer insights company, and with Kroger's knowledge of our communities, we want to provide personally relevant solutions that are easy and affordable. And again, looking at our future, we do that now in a small way, and we just see that lots more opportunity in the years ahead. Thank you.